Hello, and welcome to this podcast on the menopause. These are the topics we'll be covering today. We are going to start by exploring what is the menopause and what can cause it, moving on to some of the symptoms that can be experienced, the health impacts, contraception and the menopause, hormone replacement therapy, lifestyle changes, and finally, support links. Firstly, what is the menopause? The menopause is the time when menstrual periods permanently stop, and this is because of the lowering levels of hormones in the body. When a female goes through the menopause, it's the point at which they are no longer able to reproduce and have children, and this generally happens between the ages of 45 to 55. But in some cases, this does happen before this age, and this is known as the early menopause. Anyone who was a female at birth will go through the menopause, but for transgender people who have started hormone treatments at a premenopausal age, it's unlikely they will experience symptoms of the menopause due to the hormone replacement being taken for life. So, what causes the menopause? Menopause can be experienced for several different reasons. Generally, this is a natural process and will happen because the ovaries have stopped producing the same amount of the hormone estrogen and they don't release an egg each month anymore. However, there are other reasons why a person can go through the menopause, such as because of surgery to remove either the ovaries, the uterus, or both, cancer treatments such as chemotherapy, or other genetic reasons. Next, we're going to look at some of the different stages of the menopause and what they mean. There are a few different stages to the menopause, the main ones being the perimenopause, then the menopause, and finally postmenopause. The perimenopause happens first, and this is when you start to experience symptoms of the menopause but still have periods because the hormone levels are slowly reducing and the ovaries are producing less eggs. Some people can enter this stage before the age of 40, and this is classed as early menopause, but generally it begins around 45 years old. Next is the menopause, and you are classed as being in the menopause when periods have stopped for 12 months. Before this, it's the perimenopause stage. It's at this point that a female can no longer become pregnant, and symptoms can increase or change over time. The postmenopause stage, women can still experience symptoms, and there is an increased risk of some conditions such as cardiovascular disease and osteoporosis due to those changes in hormones. So it's really important to look after your health and be mindful of your diet and lifestyle. Moving on to some of the symptoms that could be experienced. There are many different symptoms that a person can experience during the entire menopause phase. Some will only have a few of these symptoms mildly and for a short period of time, while others can experience a high number severely for longer. It all really depends on the person and the treatment that they are given. Usually, you can spot the first signs of the perimenopause when the regular pattern of your period changes, but other things that can be an indicator are having hot flushes, trouble sleeping, heart palpitations, more frequent headaches or migraines, aching muscles or joints, changes in weight, skin changes, a lowered sex drive, vaginal dryness, increased UTIs, and sensitivity in your teeth or gums. Symptoms can continue from the perimenopause stage through to the menopause. They can last months or years, in some cases are severe enough to affect daily living, relationships, work, and lifestyle. Because of the hormonal changes that happen during this time, it does mean that there are other impacts on health that can happen. There is an increased risk of osteoporosis and changes in bone health, and this is because the hormone estrogen is responsible for maintaining bone density and strength. And during the menopause, the level of estrogen gets lower, and this can result in bone health decreasing. When bone density lowers, it can cause the bones to weaken because they're not strong, and this goes on to increase the chances of bones breaking. If someone experiences the early menopause, it can mean the process of bones weakening happens for a longer period of time because the menopause has started earlier. If you think you're in the early menopause, it's important to talk to your doctor and they can discuss options for treatments such as HRT, which we will cover later, This will help to maintain hormone levels and, as a result, keep your bones healthier for longer. Cardiovascular health can be impacted, and this is again due to the hormone changes because estrogen has a protective effect on the heart, and it also helps to control cholesterol levels, which as a result reduces the risk of fatty buildup in the arteries, keeping blood vessels healthy. Another big area that the menopause can have an effect on is mental health. It's not uncommon to have feelings of anxiety, stress, and occasionally depression during the menopause due to the hormone changes. Some of the mental and emotional symptoms that might be experienced are anger, irritability, anxiety, forgetfulness, low self esteem, low confidence, depression, poor concentration, which people also refer to as brain fog, and sleep problems, which in itself can cause a lot of other physical and mental issues. If you're struggling with mental health due to the menopause or for any other reason, it's really important to seek help and to find professional support. Next, we are going to touch on the relationship between contraception and the menopause. The NHS say that if you're on some form of hormonal contraception, such as the pill, hormonal coil, implant, or injection, it can be difficult to know for certain if you're going through the menopause, and this is because they can affect your periods. If you're taking contraception like the combined pill, it can cause bleeding that looks like a period for the time that you're taking the pill, and can also cause some symptoms similar to those in the menopause. The forms of contraception can also cause periods to be irregular or even stop completely. And again, this makes it hard to tell when you have stopped ovulating. It can be important to talk to your doctor about options for contraception if you're near menopausal age or are wanting to come off contraception completely. One of the main treatments for the menopause is hormone replacement therapy, or commonly it's referred to as HRT. The NHS describe hormone replacement therapy, or HRT, as a treatment that is used to help menopausal symptoms, and it does this by replacing the hormones estrogen and progesterone as their levels drop as you get towards the menopause. By replacing these hormones, it can help to reduce symptoms such as hot flushes, night sweats, trouble sleeping, mood swings, anxiety, low mood, and vaginal dryness. HRT is a hormonal treatment, and this does mean it isn't always suitable for everyone. The NHS says that HRT may not be suitable for those who have a history of breast cancer, ovarian cancer, or womb cancer, have a history of blood clots, have untreated high blood pressure, have liver disease, and anyone that is pregnant. It is still possible to get pregnant when you're having HRT, so they do say it's important to use contraception until 2 years after your last period if you're under 50, and for 1 year after the age of 50. There are different types of HRT which can include different hormones and other methods of taking it, for example, in tablets, gels, or patches, but it's important to find the one that works for you and make sure you ask your doctor any questions you may have and track any side effects so that they can be monitored. With the menopause, there are certain lifestyle factors that you can change or manage to help with your symptoms. There are different things that you can try for each of the different symptoms that could be experienced. However, in general, keeping a healthy diet will help. It helps physically and mentally and helps to control weight gain and loss. Regularly exercising is great for mental health. It helps with mood swings. It can help to manage hot flushes and night sweats. And weighted exercises are also good to help strengthen your muscles and protect against weak bones. Having a regular sleep schedule and getting enough sleep is important. It helps to regulate mood and reduce stress levels. Talk to others who are experiencing the same thing. Talk to your GP before taking herbal supplements and limit smoking and alcohol consumption. Finally, we have some links to places that have great information and support. Firstly is obviously the NHS, to speak to your GP or nurse or even a pharmacist if it's about things that could help your symptoms. Next is a link to Menopause Care, which is a website where you can find information and also book a private consultation with one of the doctors and healthcare professionals who are all accredited by the British Menopause Society. Menopause support has lots of information about coping with the menopause in the workplace, and they hold free drop-in events for women looking for better quality menopause information. Next is Menopause Matters, and this is an award-winning website that provides information on the menopause, different symptoms, and treatment options. They also do regular podcasts on the topic. Rock My Menopause is again another website with a whole host of useful information, podcasts, videos, and activities you can join in with. And finally is an NHS document about supporting people who are going through the menopause. And this is targeted towards both line managers and colleagues to make sure you're creating a working environment that is suitable for everyone. That's the end of this podcast. I really hope you enjoyed it, and we have many more topics available that you can find on our subscription site. Thank you for listening.